This is CBS News Bay Area with Elizabeth Cook.
Drug addicts in San Francisco could be forced to get screened and enter into treatment in order to get cash from the city.
Right now, people who are addicted are making life decisions that aren't good for them.
But would it help combat the drug crisis or make it even worse? Well, thank you so much for joining us. A week from today, voters across California will be making big decisions at the polls. And over the past few days, we've been taking a closer look at some of the key local races in this year's primary. It is clear that something needs to be done about the drug crisis in San Francisco. But should people be forced to undergo drug screenings in order to receive cash assistance from the city? That's the idea behind Proposition F. Mayor London Breed put Prop F on the ballot. And while those receiving benefits would not have to prove sobriety, they would have to enroll in treatment if the city thinks it's necessary. If they refuse, they don't get the cash. The mayor says this is about reducing drug overdose deaths. A record 813 people died just last year alone. Our Wilson Walker has more on this latest flashpoint in the city's drug crisis.
I live right here in this yellow building right here. It's a smaller place, you know, it's single rooms.
But you got a place.
Yeah, got a place, you know what I mean?
For Andrew, it has been about 10 years of homelessness punctuated with occasional housing arrangements, and he has one now. That SRO gives him an escape from the elements and eligibility for $712 a month in cash through the County Adult Assistance Program. People who are unhoused, living on the streets, they are eligible for $109.
You know, I don't take it for granted. Excuse my language, I appreciate every aspect of it, whether what it is, you know, it's not.
On this day, he has stepped outside of that housing to join friends who gather partly for safety in numbers because of the lethality of the drugs they are using. Andrew says he's currently making a push for treatment, and Proposition F could force him to make some decisions in that regard. F would require anyone receiving CAP benefits to be screened for substance use disorder. And if that appears to be the case, they would be required to participate in a treatment program or lose those cash payments.
Honestly, I think that would disqualify people that need help. Like, the drug screening is not the right approach for me personally, you know.
That is what's going to help us move this city forward out of what was a very challenging time.
Proposition F is the mayor's ballot measure, another proposal for responding to the ongoing opioid crisis. And reaction to the plan runs right along some very well-established fault lines in that discussion.
F is a cynical and unserious waste of resources that will materially harm very vulnerable people.
Lining up in opposition are many of the care providers San Francisco contracts with for the city's response to the drug crisis. No on F campaign director Sarah Short says it will hurt those already in trouble.
In addition, many people who are on the streets now and using drugs will simply not apply for assistance and therefore not have any access to treatment through the services system.
When folks are addicted to this poison, and it's the worst addiction that I've ever seen in my 2 decades of doing this work, it's literally killing people, over 800 people last year. When we're giving them up to $700 a month and they're addicted, and using that to purchase fentanyl that will eventually kill them, that's not improving people's lives. And so
Trent Rohr heads the San Francisco Human Services Agency. He says F would not cost anyone their housing or other benefits, but the cash, he argues, deserves more scrutiny. The city estimates about 1/3 of those receiving cash assistance have substance abuse disorder, and the city has been looking for those recipients during the past year's crackdown on sidewalk drug use.
21% of the people they arrested were on CAP, were getting public assistance from the city, and of those, 43% of them, so almost half of the people who were receiving locally funded public assistance said they lived in another city when they were arrested. They reported they lived, wherever else.
So it is the continuation of the debate over how to move people towards treatment, something San Francisco has struggled with and argued over for years now. Here is Gary McCoy of Health Right 360.
Always seems to be the default on like, we'll take care of this and we'll make a difference is almost always some type of punitive approach that punishes people.
People will say it's punitive. People will say it's paternalistic. Well, I would argue, yeah, it is paternalistic, because right now, people who are addicted are making life decisions that aren't good for them.
Now, those receiving the money, of course, have their own questions about how F might work. And Andrew, while skeptical of the drug screening plan, says he would like to see a different kind of drug crisis triage.
I think what would help people, like in my mind, what would help people would be like, instead of a drug screening, to like profile screen, like just have like a better way to organize the people who are actually living here. Because there's a lot of people out here that not even from out here, don't even live here, just come here just to come here and buy fentanyl and just get stuck here and just are like taking up space. Excuse me. They should find a way to screen and find out who those people are and maybe drug screen them and send them back to where they came from.
That is a conversation we will pick up another day, but F does raise the question of how much treatment is readily available for all of those in San Francisco who might need it. This proposition would pass with a simple majority vote.
Well, coming up next, we're hearing directly from one of the opponents of Proposition F, the San Francisco Coalition on Homelessness. They're going to join us in studio, and we'll be right back. Welcome back. We are continuing our conversation on Prop F in San Francisco. Now, reminder, the measure would require drug screenings for anyone receiving cash assistance from the city. Joining me now is Jennifer Friedenbach from the San Francisco Coalition on Homelessness. Why is Prop F not a good idea? We saw already 66 overdose deaths in San Francisco alone. If Prop F isn't the answer, what is?
Yeah, San Franciscans are rightly concerned about overdoses. It's been really tragic. And really, we deserve a serious response. What Prop F is going to do, in fact, is it's going to drive up homelessness. Why? Because the way it's going to work is they're going to profile whether someone's a drug user or not, and then they're going to require them to go to a set of appointments. And if they miss those appointments, they lose their assistance, their housing, and their shelter. So it's going to seriously drive up homelessness, which also drives up substance use and overdose rates.
Now, San Francisco is being pressured to take a harder line on drug use, and many of the folks who are living on the streets who are abusing drugs are refusing to get help. What's your response to that?
Yeah, we have an overdose plan in San Francisco that is really well thought out from the Department of Public Health, and it's sitting on a shelf gathering dust. So right now, we have over half of people seeking treatment getting turned away. What we need to do is prioritize making sure that people have the kind of treatment that's going to work well for them, whether that's trauma treatment, whether that's dual diagnosis because they have a mental health treatment. We need a variety of treatment modalities that are currently not in place. Prop F is not going to bring us that increased capacity, and in fact, it's actually going to drive up wait times by wasting clinician time.
You mentioned that Prop F, if passed, would possibly lead to more overdose deaths. Can you explain how that would work? Because it's intended to do the exact opposite.
Yeah, absolutely. Well, of course, when you have increased rates of homelessness, substance use goes way up. So that's a huge thing right there. But the second piece of it is that right now, one of the reasons we have big waits for treatment is we have beds sitting empty in licensed facilities because we have a clinician shortage. And with this initiative, it's going to use the money that they save by cutting people off of assistance, out of housing and out of shelter, and use that money to pay for the clinicians. And that's going to pull clinicians away from the treatment programs, and that's going to mean longer waits. Longer waits means higher overdose rates. So, this is just not a well thought out measure, and that's the reason why a variety of people are opposing it. Really, anyone who's done an analysis on it that's serious, from the San Francisco Chronicle, Spur, the Democratic Party, healthcare professionals, addiction researchers, treatment providers. I mean, all of them are coming out really hard against Prop F.
There's two kind of interesting components of this. There's the human component, the people who are suffering on the streets, and then there's the financial component. What do you say to some taxpayers who may be saying, wait a minute, these individuals are getting money from my city, my taxpayer dollars are paying them. Shouldn't there be some accountability? I mean, drug use is illegal after all.
Yeah, I think, most of the money that people who are on public assistance, study after study shows they're using for basic necessities. It's a really small amount, just over $100 if they're unhoused. And if they're housed, it's just over $700, but the overwhelming majority of that goes to pay rent. Half of the people on public assistance are renting from private landlords. They're not even getting any kind of subsidies. And so, there's very little leftover money. And that like access to money actually doesn't have any impact on whether or not people are using drugs. Addiction is a serious disease and it needs a serious medical response, something that's based in data. We're losing a lot of lives here. So we need to make sure that people have the support they need to meet their goals and be able to recover fully.
Yeah, I think everybody agrees something has to be ddone. All right, Jennifer Friedenbach, thank you so much from the Coalition of Homelessness in San Francisco.
Thank you for having me.
Well, coming up next, we'll hear from the other side of this, a supporter of Proposition F. We'll be right back. We are continuing our conversation on Proposition F in San Francisco. Joining me now is Adrian Covert, the Senior Vice President of Public Policy from the Bay Area Council. Thanks so much for joining us.
Thanks for having me, Elizabeth.
So why is Prop F important? Why should voters vote for it?
At the end of the day, San Franciscans have been in shock over the past year about the increase of overdose deaths. By the end of today, literally, there will probably be another 3 dead San Franciscans due to overdose deaths, most of it fentanyl. We're on track for having about 1,000 deaths this year. That's up about 300% over just the past 5 years. The status quo is not working. The status quo is killing people. We need to give the city more tools to compel people into treatment to save their own lives.
What do you say to folks who say this is criminalizing addicts? They are suffering from an addiction. That's a disease. This is going to deny them services and could possibly lead to more homelessness, more drug addiction, more deaths.
Well, there's no criminalization happening here. So just that off the bat. So the criminal justice system isn't being involved in this at all. This is about giving the city public health department discretion to identify when someone's being screened for homeless services, whether or not they are a good candidate, whether they have a substance abuse disorder that is going to threaten their lives, and to provide them a customized treatment plan as a condition for accessing city shelter, employment, or cash assistance.
Criminalization, probably not the right word, but punishing people who are suffering from that addiction. There's some people who say, why are you punishing these folks? They need help.
The biggest punishment here is an untreated addiction resulting in death. Again, over 800 deaths on the streets of San Francisco every year because of fentanyl. This is a new, more powerful drug, 50 times more powerful than standard heroin. Conditional recreational use is just not in the cards with this drug. If people are suffering a substance abuse disorder with it, we have a moral obligation to get them treatment. And we have the tools with Proposition F, additional tools to help try to compel them into it.
What do you say to critics, though, who say this money would be better spent on treatment programs, other services, rather than taking necessary money away from people?
Well, not everybody wants to have a treatment program. Not everyone's ready for a treatment program. I think with this measure, what we're trying to balance is compassion and accountability for the ultimate goal of saving lives. We need to start focusing on saving lives. We cannot be a great city with 1,000 people dying on our streets and in our supportive housing projects every year. Something's got to change. And so this measure would give the city tools to help compel people into service.
There is a concern, though, that if Prop F passes, that some people will go into treatment before they're ready and then relapse and then possibly go out and unfortunately pass away on the streets because they start using again. What's your response to that?
That could be a risk, but you have to weigh that risk against the risk of the status quo, which we know is over 800 people dying every day, or every year, 3 people dying every day from substance abuse disorders on the streets of San Francisco. That's the status quo. It's hard to imagine action resulting in a greater level of failure than that.
Yeah, I mean,
and so as we develop this program, there's going to be lessons learned along the way, but you have to start somewhere.
Yeah, we were talking earlier off camera that this is such a complicated issue. Do you think that this is going to be the magic puzzle piece to solve everything?
On a public policy challenge this complicated, there is no silver bullet. You solve it with a series of measures that compound upon one another to get to a better outcome. So this is not a silver bullet, but it's one piece to the puzzle.
All right, Adrian Covert, thanks so much for joining us from the Bay Area Council.
Thanks, Elizabeth.
And we'll be right back.